what are the different types of clusters in diabetes that you will have to know. So coming to the clusters, there are around four clusters. This was usually proposed by Mohan et al. Okay, so this is published recently, and you will have to definitely know about the different types of clusters in India. We have SIDD, IROD, CARDD, and we have MARD. Okay, so SIDD is a type where you have which usually behaves like a type 1 diabetes. So, yeah, so they have insulin deficient diabetes. So herein you may have low BMI, low waist circumference, poor C peptide, and high A1C. The second is a typical type 2 diabetes. Okay, here it is insulin resistant obese diabetes. You have high BMI, high waist circumference, preserved C peptide, and a moderately elevated HbA1c. And the third thing, you will have both combined insulin resistant and deficient diabetes, CARDD. Okay, this is again a novel cluster which usually has both. You have both normal BMI or low BMI with a waist circumference normal, preserved C peptide, but at the same time, they have high HbA1c and triglyceride. So this is normal weight obesity along with the insulin secretory defect. The fourth one is mild age-related diabetes. So older age, mildly they will have diabetes. Okay, they have good C peptide, they respond well to drugs, and their A1C will not be that higher. So these are the clinical characteristics of different clusters, which I have explained you right now. But why is it important? Why is clustering of diabetes very important? If you look closely, severe insulin deficient diabetes, now in this category, usually has increased risk for retinopathy alone. Okay, they have a very high risk for eye diseases. Okay, whereas the type 2 sort of diabetes, no, they are at very high risk of CKD, and for them, they respond well to metformin, pioglitazone, and GLP-1 analogs. So all insulin sensitizers, if you are using in these patients, easily this group can be aborted with CKD. Okay. SADD, you will have to put early insulin. And CARDD, the combined group, they have a risk for both retinopathy and CKD. Okay, so we will have to give a insulin along with the insulin sparing agent in these patients. Clustering and identifying the cluster is very important in management of diabetes. And mild age-related diabetes, they usually have very lower risk of complication. So usually in these patients, the HbA1c target we keep would be higher. We set the targets higher.